Also, the government shutdown is now in day 28 and counting as a Senate vote to pass a spending bill fails again today. Federally funded rural community health centers are some of the many places that are being impacted by the shutdown. They're designed to provide access to care in the most vulnerable and underserved communities. John Fairman is joining me now. He's the CEO of Delta Health Center in Mound Bayou, Mississippi, the oldest federally funded rural community health center in the United States. Thank you for being here with us today. We appreciate your time. And let's jump right in here. We know the changes in Medicaid earlier this year have already had a tremendous impact. And now there's the government shutdown. Is that making it, I imagine, even more difficult to operate?
Well, it is, in fact, making it more difficult to operate. And thanks for having us. Let me just say, though, that we're just now beginning to see the full impact of the changes, the cuts, the federal government being closed. So far, we haven't been hit very hard. We've seen many individuals who have lost their coverage either because of the changes in work requirements or what have you, or some of the changes in some of the private payers, some of the so-called CAN programs, Ambetter, WellCare, Molina, so on and so on. But one of the things that I'd like to say is we're the court of last resort, and we are the safety net. So when the private payers, the private providers, the hospitals have their problems, those problems, when they start trickling to us, are going to be the most significant impact on all of us.
And I think there's an ongoing conversation here about there's a lot of patients who were impacted by the changes to Medicaid. These may be very well the same people who will start to suffer even more by losing SNAP benefits. So are you noticing additional hardships?
Absolutely. We are seeing a number of persons who have already lost their SNAP benefits come to us for care without any source of resources. And we're also seeing a number of people who are coming to us for medical care that are also asking for assistance with food.
Do you think that there has been waste, fraud, and abuse in the Medicaid system? And is there a better way to help people who are truly vulnerable?
Well, I leave that to others to decide if there's been a significant problem. I haven't seen it, we haven't seen it, and we certainly have never been accused of such. I do think that there are opportunities to streamline care, but I don't know that the unilaterally cutting folks off is the right approach to it.
And so if you have to close some of these satellite offices or even pull back service at a main location, what happens? What kind of options do these people have?
They will have to travel further for care. They will have to delay care. We will do the best we can to use our mobile units to get around to them, but that will not replace, if we have to retrench from 17 locations in 6 counties to, let's say, 10 or 12 sites, that will be very impactful in terms of people's ability to get to care.
Well, John Fairman, thank you so much for the work that you do and for sharing your story with us. We appreciate your time today.
Thank you.